and welcome to everybody who has joined us for today's webinar. We want to acknowledge the fact that this is part of the 30-minute Monday webinar series that OraSure is launching today. This is the first of 6 webinars that will take place over the next 7 weeks. There'll be a reprieve on May 25th, Memorial Day. There'll be no webinar that day. But you can see on the screen the dates and the topics for the other 5 webinars that are part of this 30-minute Mondays webinar series. And you'll be receiving invitations to join those webinars as well. And we hope that you'll find them informative and helpful, and an opportunity and a place to ask your questions. So we're going to welcome today to today's webinar, Brian Feely, the Director of Sales for OraSure Technologies Substance Abuse Testing Division. I've known Brian for many, many years. He's one of the few people that's been in this industry a little bit longer than I have been, but we've known each other for about 20 years. He leads a team of very talented people at OraSure. They're focused on launching, or he has focused his career on launching oral fluid drugs of abuse and alcohol and nicotine testing products, and his team focuses on educating and training laboratories, TPA partners, and end users on the benefits of oral fluid testing. So today is just a 30-minute webinar, so we're going to get right to it. What we'd like to do today is sort of question and answer format. So there are not a lot of slides, but you're going to get a recording of today's presentation. And Brian, are you ready to go?
I am, Bill, and thank you for that intro.
Absolutely. So first question, is drug testing still taking place during the COVID-19 pandemic? What are you seeing out there?
Well, yeah, I mean, we are seeing that testing is still taking place, however, much more reduced than you would normally see. The types of areas where we're seeing it coincides kind of with the essential industries that where you see people employed today, right? It's in the retail space where people are really working those stores as hard as possible to keep things on the shelf. So we're seeing testing taking place in that sector. Healthcare, of course, again, people on the front lines taking care of us out there. Manufacturing in certain areas where they are making the products that need to be brought into the stores and offered in the retail space, whether it's online or what have you. We're seeing quite a bit of testing in the adult care facilities, as you probably, some of you may have seen in the news. There's quite a concern about the COVID-19 virus spreading in adult care facilities and assisted living centers and those sort of things. So they're hiring, and as they hire people, they need to continue to do the normal testing they would normally do. So yeah, so the answer is yes, but at a reduced rate and volume, as probably many folks that are on the line and listening are experiencing firsthand, because volumes are down considerably right now.
Now, here at the Current Consulting Group, we work with a lot of third-party administrators, collectors, et cetera, and employers, end users. And so we're hearing a lot about challenges that people in different markets, employers, treatment centers, and others are encountering when they try to get a sample collected. What's going on with that? Why is it becoming more challenging to get a urine sample collected, for example?
Right. Well, I mean, some of it relates to collection sites. They do have some limited hours, and some sites have even closed in certain locations, depending on the group. So you have to certainly check. You know, you have a lot of demand, though, when you reduce the number that are open and you reduce the number of hours, but you have demand. That means, you know, you're going to have lines that are going to be formed at the locations that are open. You have to maintain that social distancing, as many of us have probably gone to the grocery store or wherever, right? You have these carts, and you know you have these boxes that are keeping people 6 feet away. That's a challenge in the collection sites, and just trying to maintain that social distancing. And I think, you know, in general, there's concerns that we're hearing from both collectors and donors, employees that have to go, just because, you know, they're going out someplace. To any additional place we go these days, you have to have a little concern about, you know, is it disinfected? Is it clean? Am I going to contact someone who potentially has the virus? So, you know, you couple those limitations with the constraints and the concerns, you know, it ends up being can end up being somewhat stressful of a situation to have to go give samples right now.
So how's that affecting your world with oral fluid testing? Are you seeing an increase in requests or information or inquiries about oral fluid testing?
Well, we're definitely getting an increase in terms of requests. We're not getting an increase in terms of testing, just like everyone else. Volumes are really going down. And that's just because people are home, right? They're not in the workplaces, and there's not nearly the hiring that was going on before. So overall, our volumes are down too. But there's this increase in questions that we're getting about oral fluids because I think in general people feel like this is a sample that can be collected and while maintaining social distancing, whereas others can be a little bit more difficult to achieve that. So yeah, we're seeing an uptick. We're seeing an increase in requests for information, not just in traditional employment drug screening, but also in insurance risk testing, where traditionally they're looking to get away from testing fluids and reduce that and go to things like simplified issue. We're seeing an increase in the interest in oral fluid testing and in public health as well. In general, people want to avoid blood, finger sticks, and they want to avoid urine and other things that are considered to be typically a little bit more infectious. So even potentially could change the way things, we're in a world today, of course, we're pre-COVID. We were in the process of implementing oral fluids for regulated testing. So we were seeing quite a bit of interest develop around oral fluid collections and oral fluid testing before this. And so now with the added requests on oral fluid testing, we think that should only increase even more so as we move forward.
So last October, the Substance Abuse and Mental Health Services Administration issued guidelines for lab-based oral fluid testing. And one of the things they really stressed was the collection process. And so we've got a lot of people on the line today, and some of them may not be familiar with how an oral fluid collection takes place. How easy is it to collect an oral fluid sample? How long does it take?
Well, it's really quite easy, and the time that it takes is a little bit dependent upon which device you select. But you're typically looking at somewhere between a 5 and 10 minute process for an oral fluid to be collected. It can be a little shorter depending on the device and the facility you're going to, and how long it takes them to really get the supplies together. But typically the groups that are doing this, the collection facilities and collectors, third-party administrators, et cetera, that are doing these, they're skilled at how to conduct the oral fluid testing, and they have everything available to do it, and it happens very quickly. So the types of steps that are involved: number one, you want to have your supplies handy. You want to check to make sure that the collection device you're using is not expired, that it's a valid date, right? And you want to identify the donor just like you would any other collection through a license or ID. Explain the test to them, and then basically the neat part about oral fluid is the collector or the administrator of the test is really an observer. So they're not as involved in collecting that sample and testing it as you would with other sample types, where you might be dealing with the tubes and pouring off samples to create a split and all that sort of stuff. With oral fluid, you basically walk the donor through it. So you tell them to open the packet, they open it up, they stick the swab between the cheek and gum or under the tongue, whichever device method you might be using. They hold it in place for the prescribed period based on the instructions. The swab comes out, it goes into a vial. They basically, put the seal on the top, and chain of custody seal of forms filled out by the person that's observing the collection, and that gets put into a bag and shipped to the lab overnight. So it really, we have one procedure we call swab, snap, and seal. So it really is, the donor swabs, they put it in the vial, they snap the handle, they put the lid back on it and seal it, make sure it's nice and secure. The seal goes over the top, which has the donor's initials and date on it, and then it's sent to the lab for testing. So much of that, if not all of it, can be done while that donor's at 6 feet distance. The device can be placed on a table where they come in, they sit down, everything is in front of them. They're instructed on how to do the collection, and then out it goes to the lab. So it's one that you get the benefit of a directly observed collection. So because the collector is watching everything that donor is doing. but you also maintain that social distancing, which is so important today.
So, and it looks like maybe we had this planned a little bit, but I just sort of anticipated that you might want to look at this or talk about that process of how
Yeah.
easy it is. So you kind of answered the question, but is there anything significantly different that is worth emphasizing when comparing an oral fluid to a urine collection?
Well, so as you know, I mean, with the urine collection, the large majority of them are done in bathrooms or pop-up type facilities out in the field. So they're not observed. The donor goes into a facility typically in an unobserved fashion. So that does provide the opportunity for them to potentially adulterate or substitute their sample. Or they can dilute it, use things ahead of time like that dilute the sample down to a level where the drug concentration that somebody might have been taking is now below the threshold of the test. So, one big difference is the fact that most of them are not directly observed. And they go into a bathroom, which today, I guess one of the differentiators here is also the fact that they go into a bathroom and if that's all that facility is doing, then you have a lot of people going in and out of that bathroom. So how do you assure that that's been decontaminated? Because you're not talking about one little surface. Like when you do an oral fluid collection, you've got that very well contained. It's one little space. You can have the collection done, that person leaves, you can easily decontaminate that. And with a bathroom, maybe not quite as much. So those would be two differences: the fact that it's not directly observed, and you could end up having some additional risks of contamination in a bathroom that you can't always decontaminate the entire thing after someone comes out.
So let me jump ahead a little bit because I'm seeing some questions come in from the audience today, and even more people are joining the call a little bit late. So let me jump down to the third to last bullet. Is it safe to collect an oral fluid sample? Because people are asking, they're not asking that so much as they're asking, is it safe to collect a urine sample? So from a safety standpoint, what's the comparison and what would you say to collectors?
Well, so I think generally, if we're talking about oral fluid, I'll try to differentiate between the two of them. Oral fluid is generally a safe specimen to collect if you follow the precautions that people are following with everything else we do today, right? Which has to do with, number one, you want to make sure that you're not allowing donors into a facility that are sick in any way. So first step is, no one should be allowed to give a sample if they have any signs of being sick. But secondly, adhering to the 6-foot rule, making sure that people use gloves and a mask. I think we're all doing that pretty much daily now anyway when we go out. And third, to decontaminate that area and make sure that when donor does leave, that the area has been decontaminated and gives plenty of time to dry before the next collection is done. And then always using a new set of gloves. When the next donor comes in. I mean, I think you generally want to do the same thing with urine. You want to use all those precautions. And difference being that within some areas, if you're doing a pour off of a urine sample or a split specimen, you have someone that may be actually handling that sample in that clinic, and they may have to actually open the container and split it or handle the urine in some way if they're doing a dipstick test. So there could be more risk there if you have an open container where someone's actually manipulating that sample, and that would be one of the bigger differences and watch outs. And I would imagine that a lot of that's not taking place too much today in those facilities, but it could be.
Okay. So it sounds like an oral, and I know we've got the question up there. I'm going back to where we were. It sounds like an oral fluid collection can take place anywhere, but there must be some qualifications or criteria for that location where it's going to take place. I mean, it could take place in the workplace or it could take place at a collection facility, right?
Sure. Yeah, we see it all over the board, Bill. I mean, we have collections that are done by groups, third-party administrators, mobile collectors, doing it in vans, doing it in offices, warehouse facilities where they have a room they can take someone into in the field. It's really not limited by having a bathroom or a pop-up, toilet, if you will. So much more versatile in terms of where you can go to and where you can conduct an oral fluid collection.
Okay, and who can actually qualify to do the collection, to observe it or oversee the process to make sure it's done correctly?
Right. Well, I mean, so traditionally, thinking about this from the last 20 years or so that we've been in the oral fluid game, it's been all non-regulated testing, right? And so the people that have been doing oral fluid collections are those trained. And at least for us, I know with our processes, we've tried to write our training documents and we have videos and stuff that have quizzes associated with them. So you have to take the test and you have to pass the test in order to get the certificate. So we've tried to model it after what a regulated program would look like. So you have that regimented program. So, but in the past, up until now, where we're going to get into regulated testing, it's always been anyone that goes through that training program that is gets certified, even though it's not an official certification right now. It will be. Anyone that goes through that process and can demonstrate that they can, observe the collection and they can take the test and they get it right, really can observe an oral fluid collection.
And what is meant by, we're hearing this a lot now, and I just saw it on the news the other day, what's meant by a donor-driven collection or an employee-driven collection?
Right. Well, that's basically the process of you being an observer, whether it's a collector or third party or other administrator, you're really observing that collection, and you're not doing that collection yourself. Like with certain products and certain steps, like alcohol testing, for example, when you blow into a breathalyzer, or in other processes where you're actually doing the test, an instant test, you're much more involved in that process. With a laboratory-based oral fluid collection, you're an observer to it. You're basically instructing the donor on how to do the test. So they're opening the packet, as I described before. They're basically administering the test, the collection process on themselves, and the observers just making sure they go through the right steps, that they dot all the I's and cross the T's, that the paperwork is filled out right, that goes in with the sample that's sealed and dated. So the donor really does most of it, and that's, I think, what people really mean is a donor-driven process as compared to one that might involve more of that collector or drug tester's role. This is not that way, unless of course you're doing an instant oral fluid test. Then it's a little more involved than a lab-based donor-driven process.
Okay, thanks. Now I'm skipping down to the bottom because we got a ton of questions that have come in, so I want to get to those. But let me just present something that somebody emailed me the other day and said, I understand that toxicology labs are not accepting oral fluid samples right now. I wasn't aware of that. I hadn't heard that. Is there any truth to that?
Not that I'm aware. I mean, I've not heard that at all. And we have, literally dozens of labs that work for us, or not work for us, but utilize our products. And I know there's a few other competitors out there that sell devices and oral fluid tests to laboratories. I haven't heard of any of them not accepting samples. So okay. I'm not sure where that's coming from, Bill. So I mean, There could be laboratories who are having difficulty right now staying open, just because they're furloughing people and they're not able to adequately stay open and process a lot of samples, just from an economic standpoint. But I don't know too many of those labs, but that maybe there's some confusion between those labs that are adequately functioning today versus someone that's not allowing an oral fluid sample. I've not heard that at all.
Yeah, I hadn't either. And I was doing a webinar last week and somebody wrote in and said, quote unquote, I know that non-DOT random testing has been suspended throughout the country. And it was like, well, that's not true.
Right.
I mean, that's, a lot of information, a lot of misinformation out there. So here's the first question. And I know you guys work with a lot of clinics and a lot of companies that run collection networks. So this first question I think is important to ask, which is, are clinics a sign of the past as far as drug testing is concerned? Are businesses feeling uncomfortable sending employees to a clinic where potentially they could contract the virus?
My answer to that is no. I don't think that is a concern. I mean, it's a concern today, but as we come out of this and get the virus under control, which we ultimately will, and this thing there'll be adequate testing out there. There'll be people who will be essentially immunized from getting it, and herd immunity, those sort of things you might be reading about. And there are vaccines that come about. Eventually this will be a controlled condition, and that should by no means have an impact on collection sites not continuing to play a major role in the market. So no, I don't think that's true.
Okay. Here's
I think
another one.
For oral fluids, just to expound on that one additional sentence or two, is that for oral fluid testing, it's probably even a better thing, because as we get into the regulated markets, and there's going to be the same type of training, if not more stringent than what we've required in the past for collectors to do oral fluid. A lot of people the end user market is going to want to do oral fluid testing for their employees, just because of the inherent advantages of oral fluid. Difficult to beat, the recent use aspect, and it's just more dignified collection. So collection sites and collectors, I think, are gonna be seeing more demand for oral fluid testing, which should further validate the existence of using collection sites and clinics for doing drug test collections.
Okay, and I know you said at the outset that you're seeing a clear, obvious increase in interest in lab-based oral fluid testing generally. So has there been, or is there a shortage of like OraSure Intercept kits? Are they readily available? And what would you say to somebody who says they're having problems getting the Intercept kits?
So no shortage on Intercept kits. Please call us and let us know where you're trying to get them from, because we haven't had any issues supplying them. And the only thing that can sometimes happen is if you have a lab out there or a group that's getting these and they're kitting them up, if they have a bottleneck right now in their facilities, which I haven't heard of, but I'm offering a possible scenario where, because we don't have any shortage on making them and we have plenty in stock right now, that the bottleneck could be at the other end, where they're kitting them up and getting them out the door, just because of a low level of staffing or whatever. But I have not heard of that, and if anybody's experiencing that, they should definitely let us know.
Okay, and here's a kind of a similar question. I know that OraSure provides the OralTox Instant oral fluid testing product. We are an alcohol and drug screening collection site. We're having a terrible time trying to get supplies and kits for POCT testing. What would you say to that person? How could they do that, solve that problem?
Well, it's a little general for me to say. I don't know where they're getting their supplies from. I know that I haven't heard specifically of a shortage of OralTox, or on our end, QED, we make the saliva alcohol test. We can get both of those and supply both of those. The bigger shortages that we're hearing about out there, of course, relate to COVID-19 testing, with the antibody tests and all the things, that the swabs and all that sort of stuff. So we're working on a COVID-19 antibody test that will be something that will be very convenient. Again, an oral fluid based type of a methodology, where you collect an oral fluid sample, send it to a lab. Some of our existing labs in our network today will be offering that, but not necessarily on POCT, or certainly not on our products, Bill, in terms of a shortage.
So I was watching a segment of Good Morning America over the weekend, and they were talking about oral fluid testing for COVID. So it was in this particular one, they were talking about workplace testing. So going forward, and the statement that they made was that with oral fluid testing, it's a game changer in terms of being able to get these tests done quickly and efficiently. So going forward, do you see workplace COVID testing, or maybe COVID testing in other markets, as sort of part of the new norm going forward?
Well, certainly part of the norm, I think, for the next foreseeable months of getting people back into the workplace, because employers are going to need a way to know that people that are coming back in are safe and that they aren't currently infected. Ideally, that they've even had exposure and have antibodies, so that gives them some immunity. How that's all going to shake out, I think, is all kind of going on right now in terms of how you'll look at an employee, one that's asymptomatic, of course, and hasn't had the condition, one that's asymptomatic and maybe does have it and has antibodies. There's different ways to look at those different employee bases. So I think a norm for the foreseeable future is definitely going to be doing COVID testing. And we've been talking to third-party administrators and employers pretty regularly during the last 3 or 4 weeks. And they're all looking for these products to come out, and the instant ones have been out, and some of them are okay, and some of them have some issues related to them in terms of performance. I don't want to speak badly of any other products that are out there. I can only tell you that we're working on a laboratory-based antibody test that will be based off an oral fluid sample that will be very accurate, highly sensitive and specific, and we'll have a threshold that you'll be able to know that someone had this, and they were exposed to the virus, and their antibody level is at a certain threshold that would qualify them to have been positive on that test, which could be looked at as a good thing.
Okay, and I can just say that here at the Current Consulting Group, we've been doing a ton of research on the legal aspect and how to address it from a policy standpoint. How does the ADA or HIPAA laws come into effect? And so just a ton of new area that employers are going to have to be educated on, so that they do it right. We've got a lot of questions here. I'm just scanning through them, Brian. A lot of questions about how to make sure, and these are all oral fluid collection related, how to make sure the collection process is as safe as possible. There's questions about PPEs. There's questions about, what happens if the collector comes in contact with an individual's saliva. Maybe some of it got on the collection vial or something like that. I don't know. How would you address that? I mean, some of it seems obvious, but from an OraSure perspective, how would you address that issue?
Well, I think as I mentioned before, you start with using all the right precautions so that that kind of stuff doesn't happen, and you don't have a sample that is on anything that the donor touched and put onto that surface, and now the collector is exposed to that. Because again, if they're doing everything based on that donor-driven process, that vial is, even if it had something on it, which it really shouldn't if they do it right, but even if it had something on it, it goes into a sealed bag, and so that bag then goes into an overnight shipper. So my suggestion would be use the gloves, use the mask, stay 6 feet away, let the donor do almost everything that they possibly can, make sure surfaces are decontaminated, make sure someone's not sick, and that the vial goes in to the baggie, and it gets shipped off to the lab. So, I mean, there may be some other precautions in terms of using disinfectants there that one could adapt to their workplace, to that setting where that collection is taking place. I think there's so many creative things people are doing out there today. When you walk into facilities, it's stuff you wouldn't even have thought of before, that is being done to keep people safe and clean. I think some of that has to be brought into it too. We're not necessarily experts in disinfecting, but certainly are in terms of the oral fluid process. And I think overall it's pretty safe if you follow the right precautions.
Okay, and we're down to the last minute, so I'm going to try to get a couple of rapid questions in with rapid answers. Here's the question that I bet you've answered a million times: is what time frame do you think it will be before oral fluid testing is approved by DOT?
I would give it another, at least a year before I think the guidelines are. I mean, you may actually see guidance first and their proposed rulemaking out sooner than a year, but everything has slowed down now, so it's really hard to tell when those are going to come out. If it does come out this year, you can probably add on at least 6 months to that in terms of DOT rules, till it's implemented. My guess is at least a year.
Okay. Now, to the audience, let me say there were questions we couldn't get to. We guaranteed you, we promised you we'd do this in 30 minutes. We couldn't get to everything. We will answer all of your questions. We'll gather them all up, send them to Brian. and coordinate the response to that. Brian, in conclusion, is there anything you'd like to add?
No, just thanks to everybody for attending. I don't know how many people are out there, but stay safe and, let us know if you have any questions. We're here to help.
Okay, and with that, let me just remind you that the next 30-minute Monday webinar will be on Monday, May 4th, saliva alcohol testing. I'm excited to let you know that Jan Corman from Core Management, who's been in the industry a long time, will be our co-presenter that day. And so I hope that you'll join us for that presentation next Monday, May 4th on saliva alcohol testing. Thank you for joining us, and that concludes today's webinar presentation.